Fentanyl is significantly more dangerous than other drugs that come through the laboratory. A very small amount of fentanyl can be very dangerous for anybody.
We were fortunate to have information that fentanyl was on the increase in the drug supply in the eastern part of the U.S. We had not seen it here in Colorado, but we knew that it was coming toward us in one way or another, and that gave us time to prepare our processes and our methods in the laboratory to be able to detect fentanyl when it did show up. So I would say having that foreknowledge gave us the ability to be ready to analyze and to detect fentanyl when it showed up here in roughly 2017. In addition to that, it changed how we look at drugs in the laboratory. We were using processes that had been in place since the 60s and 70s. Those all had to be changed to more modern and different methodologies, but that took a lot of money and a lot of time to pivot to that.
My biggest piece of advice for other countries that have not had to deal with the fentanyl crisis yet is to get ahead as much as possible with funding for instrumentation, with validating your instrumentation and technology for specifically fentanyl and other analytes and analogs that might be emerging in the drug world.
Talk to others and see what they've had to deal with, and look for the money now and get the grant funding or other funding from government in place now, and be ready to handle this, because it's just a matter of when, not if.
The Wellness Wendy provides resources and services to anyone that might need it. So when I say that we provide resources, that's just basically whatever that person may be experiencing, just try to find them support and help. I know what it's like to be desperate, to think that you are a loser, that you have nothing to give, to be so addicted to a substance that you would literally do anything to get high. I know what that's like. It's wanting to make somebody's life better just by being there, because we all need somebody. We all need cheerleaders. We all need support, everybody.